Open enrollment in the federally facilitated marketplace, HealthCare.gov, has ended. I'm Bryn McBride of ABC for Health, and it ended with a bang. We had over 4 million people make plan selections just in the last week of open enrollment. Now, you'll remember open enrollment ran only from November 1st through December 15th on HealthCare.gov this year, 6 weeks shorter than last year. So it was half the length of open enrollment, and we saw 4 million people make plan selections in that last week of open enrollment. 75% of them were returning customers, while 25%, give or take, were brand new to the marketplace. That's a great number. If you're thinking cumulatively for the entire open enrollment period, we had 8.8 million people make plan selections. And if you were to count all of the family members included on each of those applications submitted on healthcare.gov, we're talking about 11.27 million people securing healthcare coverage for 2018. Now, these are great numbers, and a lot of advocates and health policy experts are speculating what that enrollment might have looked like had we had an additional 6 weeks like we did last year. Folks in Wisconsin saw about 227,000 plan selections just in the state of Wisconsin, with almost 100,000 people signing up in just that last week of open enrollment. Now let's compare what we had this year to that longer open enrollment period of last year, and you'll see the numbers are pretty close. As of January 14th, almost the end of open enrollment for 2017 coverage, we saw about 8.8 million plan selections. Well, that's what we had thus far in our open enrollment period for 2018 coverage, 8.8 million plan selections. There's a little variability in these numbers. Open enrollment ran a little longer than the numbers that we have in our snapshot last year. Also, if you're looking at cumulative numbers for number of people covered on applications, what's not included in either of these snapshots are the individual states that run their own marketplace, like the state of Minnesota or California. So when all is said and done, and some of those states, like New York, run their open enrollment through the first several months of 2018, they have an extended open enrollment period. We'll then, after all of those numbers are tallied, be able to put a number together that lets folks know how many people actually secured coverage on a marketplace in the private market for 2018. Now, these numbers are available. You can visit them at the CMS newsroom. They've provided these snapshots throughout. Some health policy experts say to read the fine print. Some of these total numbers that are being released by CMS might not actually be the final count. This was as of a certain time on December 15th, and there still might be a couple states reporting that wasn't included as of the stop time when they ran their press release. So either way, we know we've got a solid 8.8 million plan selections covering a solid 11.3 million people, and that's a great outcome considering all the variables that made this a difficult open enrollment period. You can read that CMS newsroom request, or you can send us an email, share your open enrollment story with us, or get in touch with us any other way, and you can do that on healthwatchwisconsin.org. Thanks for joining us.